welcome back. We are on diabetes medication here as part of the Diabetes Eating and Wellness series. Back here with our favorite endocrinologist, Dana Stallings. Thanks so much for being here today. Take it away.
We do not prescribe these medications for patients that often anymore because of their side effect profile, which we'll move into next. But the brand name of these medications are Starlix and Prandin, otherwise known as Meglitinides and Repaglinide. These medications, much like the sulfonylureas that we've already discussed, help the beta cells in the pancreas to release more insulin. But again, we're looking at a medication that is not selective. And so when you take your Prandin or your Starlix, it is going to stimulate the pancreas to make more insulin, to lower your glucose levels, whether you need it or not. So this is not a medication that you want to take if you are running out of the house and you're skipping breakfast, or you know that you've got a busy day coming up and basically you're not going to eat again until dinner time. Because the primary side effect of these medications is low blood sugar. Again, we are stimulating the pancreas to make more insulin. And if you do not have enough glucose in your bloodstream to support the extra insulin that you're asking for from these medications, then it's going to result in a low blood sugar or a hypoglycemic event. So be very mindful of eating and not skipping meals when you take this medicine. Some of the other common side effects, of this medicine is nausea and diarrhea. These are the primary reason that patients do not continue these medications, because it can cause bloating, it can cause nausea, it can cause diarrhea, and that's not something that we want to live with all day. It can also cause headache and back pain, joint pain less commonly, and again, cold symptoms, kind of like a stuffy nose, sore throat, sneezing, but the primary side effects are going to be the nausea and diarrhea, as well as the risk for low blood sugars. Severe pain in your upper stomach, spreading to your back, nausea, vomiting, again, can be a early sign of pancreatitis, like we discussed in the DPP-4 class. Again, not something that happens very often in these medications. It can speed up your heart rate. It can discolor your skin or your urine. Fever, confusion, weakness, skin reactions. Not very common with this class of drug, but because these more severe side effects sound scary, and it's like, why would I take medication that's going to cause all of those things, or could cause all of those things? That again is one of the reasons that we do not use this medication class very commonly anymore.
Gotcha. Great. Thanks so much, Dana.